How long does it take to heal from patellar tendonitis, also known as jumper's knee? Well, if you go to the doctor and they diagnose you with jumper's knee or patellar tendonitis, most doctors will give you an estimation of 4 to 8 weeks to fully recover from patellar tendonitis. But what they're thinking about with your case is only how long it's going to take for things to flare down, for the knee pain to go away, and if you have any swelling, for that to go away too. And the reason for the range is because depending on how severe your pain is and your swelling is, you might need longer. So 8 weeks is typically the upper end for swelling to go down. Now they'll give you instruction to rest, maybe ice it, and avoid any activities that flare it up, especially if you're an athlete or you do some consistent exercise that may have contributed to this knee pain. Then they'll tell you to back off of that or maybe even stop it completely. Now it's easy for a doctor to tell you to just stop, but if you love playing the sport that you're doing, or if you love to go to the gym or to run or do any form of exercise on a consistent basis, then it probably just kills you on the inside to have to quit doing that, especially if you're a part of a team and they're counting on you, you're one of their star athletes. It's tough. So one of the problems that people run into with patellar tendonitis is they jump into the sport too soon and then re-injure it and kind of stay injured for much longer than they need to. So what could have healed in 4 to 8 weeks now takes 3, 4, 5, 6 months. Some people deal with this for a year or longer, even multiple years. And my intention is to not make you feel guilty about jumping into the sport too soon, because I don't think it's your fault. I think it's everybody's fault and nobody's fault at the same time. It's kind of our healthcare culture. We like to treat things with medications and injections, and if there's a surgery for it, we like to try to do the surgery too. But fixing patellar tendonitis requires correcting the root problem. And the root problem is a muscle imbalance. It means you're compensated in some way and it's causing you to put too much tension through the tendon right below the kneecap. Our healthcare industry just doesn't really understand how to treat this. So if you go to a doctor and they're telling you to just rest, take medications, maybe wear a brace, that's not going to completely solve the problem. And when you get to feeling a little bit better enough to go play again, to go run and be active again, then there's no guidance on what to do. How do you get back into the sport without re-injuring yourself? Sometimes a doctor will send you to a physical therapist, which makes sense because physical therapists are exercise specialists. However, this usually ends up in not fixing patellar tendonitis for the long term anyway, because most physical therapists help people recover from surgery. And if you have patellar tendonitis, you probably haven't had surgery. In fact, you're looking to avoid one. You don't want to have to be in there longer than you need to. You want to get back to sports, get back to being active again. But a lot of physical therapists don't fully understand how to treat this problem because they're specialists in helping people recover from surgery. And so they may often default to giving somebody with patellar tendonitis the same exercises they give somebody who's recovering from an ACL surgery or a knee replacement surgery. And that's not usually what's needed for that person, for the person with jumper's knee or patellar tendonitis. So as a result, you end up doing the wrong exercises and actually doing exercises that might feed into the problem. This happens a lot. I get a lot of patients that come in and say, I went to physical therapy and my knee got worse. I swelled more. I actually couldn't even do anything after therapy. So you need to make sure that you're getting the right kind of treatment that's focused on healing the problem naturally by a specialist who helps people recover from problems like patellar tendonitis without surgery, without medications, and without injections. And that's what I do. And I would love to help guide you. If you're looking for guidance on fixing the root problem that sets up patellar tendonitis, I've got a lot of videos here on YouTube to help you out. You can find a playlist of the videos in the description below. It's called the Runner's Knee and Jumper's Knee Help Playlist. I put them together because they're very similar. And I've also got a program called a Patella Pain Recovery Program. This program is great. It's got over 30 videos and it's as if I'm teaching you in person. As long as you've got a device with a screen on it and access to the internet, you can get into this program and start learning how to fix the root of the problem that causes patellar tendonitis. So go check out the link for that also in the description below. Hey, thumbs up this video if it was helpful for you. Share this video with a teammate or somebody that you think needs to see this because they have the same problem. And comment below if you thought this video was helpful for you or if you have a question. We love to answer all the questions that come through in our comments. And please subscribe to our channel if you haven't already and turn on the notification bell. Thanks for watching, friends. I'll see you in the next video. Bye-bye.